One of the things that I think people are most worried about these days is the issue of retirement security, and obviously many of you who are now retired recognize how difficult it is on fixed incomes to manage all the costs. My grandmother is somebody who is still living by herself and is always concerned about rises in costs, whether it's for electricity or her health care premiums. A secure retirement is no longer a guarantee for the middle class. It's harder to save, it's harder to retire. Pensions are getting crunched. The promise of Social Security is growing harder to keep. And that's why I want to fight every single day to extend the promise of a retirement that is dignified and secure.
My next guest is Barack Obama's economic policy director, Jason Furman. Before that, he directed the Hamilton Project at the Brookings Institution, which focused on economic policy, and he was special assistant to the president for economic policy in the Clinton administration. Jason Furman, welcome.
The whole Obama health plan is centered around tax credits. It would actually reduce taxes relative to where they are today, and that would be paid for by a set of spending reductions.
What programs would you cut or reduce?
For example, private plans within Medicare get really large subsidies right now. We should move those subsidies down so that they're competing on a level playing field with the public plans.